Selamat pagi. We are
Charlotte,
Reden,
Jitske,
Brit,
Kani.
and Eric, and we spent the past 6 weeks in Malaysia.
Our first week started at the cardiology ward and cardiothoracic surgery of the UITM Faculty of Medicine at the Sungai Buloh campus. Here you can see me observing an open heart surgery for coronary artery bypass. We also got the opportunity to follow a program on forensic entomology at the Institution of Medical Molecular Biotechnology at Sungai Buloh campus. Here we learned how flies can be useful during investigations of estimated time of death.
The second week, our internship started at Hospital Al Sultan Abdullah in Puncak Alam. We were attached to different departments, which were surgery, nephrology, gynecology, and gastroenterology. We all got to see really diverse outpatient clinics, surgeries, and other medical interventions. We also got to practice our colonoscopy skills.
After our internship in Sungai Buloh and Hassa, we went to the island Borneo. Here we followed an edutourism program at the Malaria Research Center of the University Malaysia Sarawak, in short, UNIMAS. We started a 10-day internship in Borneo with several lectures. Furthermore, we visited the lab on multiple days. Here we did PCR on our own blood. Next to that, we made a thick and thin smear. We later examined these with a microscope. There was also a field day in the program, where we tried to catch mosquitoes and mosquito larvae. Later on, we dissected the mosquitoes under the microscope.
During the weekend, we visited a wildlife center with 28 orangutans. We also visited the Borneo Cultural Museum, where we saw a different perspective on history. As part of the tourism part of the program, we even went kayaking. After the weekend, we went to the gamification center, where we learned to make a combination between fun and a learning activity. We ended our stay in Borneo with a presentation about our stay.
In the last days of our internship, we joined a mobile clinic of primary care in Simpang Rengam, Johor. We saw the whole process of the mobile clinic. It started with registration. Then we took the blood pressure and we measured blood sugar of the patients. The next stop were consultations and physical examinations. The patients ended the mobile clinic at the pharmacy. We also saw dental procedures.
We visited the Orang Asli in Kuwang, Selangor, during a mobile outreach. We played some brain games with the adults that were waiting for the medical consultations. Next to that, we played some easy games with the children of the Orang Asli. We played rhythm games and taught them how to wash their hands. We even played hide and seek and did fun dances like the Macarena. Lastly, we distributed care packages to the people of the village.
We visited the National Leprosy Center of Sungai Buloh. Here we visited a museum about leprosy. We also saw patients that lived in the leprosy center in their own chalet. There was even a ward in the leprosy center with multiple geriatric patients whom we visited and talked to.
The last day of our internship, we had a tour in Damansara Specialist Hospital 2 in Kuala Lumpur. We noticed a big difference of this private hospital compared to a governmental one. The private hospital was very luxurious, which made it feel more like a hotel.
Overall, we really enjoyed our time in Malaysia. The diversity of the program gave us more insight in the differences between rural postings, government hospitals, and even private hospitals.
We want to thank all the institutions for having us and hope to see you again.
Terima kasih, jumpa lagi.